Lines issue, are you happy with it? Like you see
Yeah.
the streets so empty?
So thank you so much. I think for me, it's basically looking at our health facility. So I just been viewing some health facility and talking to our partner here. And from here, I'm leaving to go to Redemption Hospital and check what the situation there, then pass over to look at JDG Hospital. But in the meantime, we try to make sure that compliance is ongoing. And I'm so grateful to the people of Liberia. The street seems to be very calm. And hopefully, as time goes by, more people will be compliant.
How does this help in curbing the spread of transmission?
Yes, so what we are doing now is that we think that social distancing is the best way to curb the transmission. And as a team, we have been meeting and putting in place what are some of those things that we anticipate after the 21 days. So we will be coming to the Liberian people, letting them know that these are things that we hope to accomplish after 21 days. And then based on that, the indicators will determine what next step to take. But I think if we all do what we are expected to do, that is social distancing and so forth, we should be able to be in a better position.
Logistics for practitioners and frontliners, is it adequate?
Definitely no, it's not adequate. Even at the international level, for example, the United States, they do not even have adequate logistics. So for a challenging country like Liberia, we do have logistical issues. But what we're trying to do now is to maximize the minimum that we have and use them appropriately. So the appropriate usability of some of the things that we have will determine how much it can last us and when do we get our next supply.
Kateh, a lot of people have been raising this concern about during the Ebola outbreak, you had active case finders. Where are the epidemiologists? Are you making use of them?
I mean, we do have active case finders. What people are not seeing is the massive personality they saw during the time of Ebola. Remember, during Ebola, it was a different situation. One is the fact that you had a lot of international support, and every international group had their own case finder and supplying active case finders in the community. Now everything is being borne by the government. And based on this disease, we also have to be very careful. You don't want to put too many people that could also be exposed. So what we are trying to do now is looking at the data. Based on the data that we are having, we just have Dr. Luke Bauer, who tomorrow will be able to synthesize the information we have and analyze them and tell us those key areas within the district, because Mosorado County is divided into districts. So those districts that we have a high concentration, this is where we're going to put most of our resources.
So what about the epidemiologists? Before 2014, we had only 2. At the close of 2018, we could boast of at least 70. Between also honor your watch.
Yeah, we do have a lot of epidemiologists here, and they are all working together. So in terms of manpower, we are not lacking manpower. We have them, and as we develop the surge capacity, we'll bring more people on board.
The issue of ventilators also, do we have them? The cases are rising spontaneously.
Yes, the last analysis we did, we have about 5 functional ventilators in the country. Personally, we have about 2 that are ready for the 14 military hospital. Luckily for us, most of our cases have not gotten to the point. But in the meantime, we have engaged the anesthesiologist at Jackson Hebdo Hospital, who is now going to do a short training for the nurse anesthetists to do intubation, and then we have respiratory therapists that will also go ahead to maintain these ventilators if the need arises.
Do we have respiratory therapists in Liberia?
Yes.
And how many of them can we speak of?
We do have respiratory therapists in Liberia. I cannot give you the exact number of them, but I think we have adequate that we can use now and build such capacity.
How many ventilators are we expecting that probably could help us to prepare us better, maybe? Not praying for it, but for the worst.
Yeah, it is hard to say. Based on the case load that we are seeing, the need is not. But I think if we should have not less than 25 to 30 ventilators, we think we can begin with that. But I'm sure that with the resiliency of the Liberian people, and we may not be able to use many ventilators. We're just keeping our fingers crossed. But I think the best thing is early diagnosis is the key to this whole thing.
The last part of it is the security personnel who are in the street trying to keep people off. They seem quite vulnerable. Is that a concern of you?
Yes, we've talked to the various joint security. And as a matter of fact, we are trying now to see how we can also provide basic things that they will need in order to protect themselves. So as it stands, you see me here using my local made mask, and I will encourage all Liberians to begin to use the local made masks. And those masks that we have in country can only be used at the treatment unit and so forth. And the N95, no, they should not be used in the street. They should be used by those that are actually dealing with the confirmed cases.
Now, how actively involved are the students at Douglas have been using them?
The thing here is that we're just starting building the cases. But yes, in our plan, we have them in our plan and so forth. Personally, there are some of them that have already been talked to be on the team in terms of management. So yes, we're going to use almost all of the resources that we have, and that include the medical students, especially the 4th to 5th year medical students, and other doctors and other personnel within the country. Even if need be, we will be able to get in contact with some of our retired doctors and so forth to bring them on board.
Thank you, Dr. Kateh.
You're welcome, sir.
He's Liberia Chief Medical Officer, Dr.
Yes,
Francis.
Dr. Francis Kateh, Liberia Chief Medical Officer, speaking to us. Thank you for being there.
Coronavirus prevention in Liberia. Its signs, symptoms, mode of transmission, and prevention.
Let me say it real. The sign, it will show you the sickness that will catch you, how you can catch it, and how you can protect yourself.
Man Benu, what really making you sit down so sorrowful like this?
Abulai, you not hear the Ministry of Health say one new sickness called coronavirus making people sick in other countries than in the world?
Coronavirus? Hey God, what kind of sickness is this again? How people can catch it?
Abulai, my dear brother, the doctor people say this sickness start making people sick and now spread around plenty countries around the world. And you can catch this sickness when somebody get